Hi there, my name is Siobhan. I'm a GP based in Northern Ireland at Vitalis Health in Belfast, and I thought I'd talk today about something that I know pretty well personally as well, and it's a big part of medicine that doesn't get taught, certainly in medical school, to doctors, and I'm not even sure about nurses either, and that is breastfeeding. And I'm talking about this because in particular to low breast milk supply, because I had a low milk supply, and I actually didn't do any reading on this before delivering our first child. So I was in my 40s, and they want to deliver your baby a little bit earlier because there's increased risk of complications even if you go to term. So being a doctor, I assumed this was the most natural thing in the world. I'm pretty laid back. Didn't have a lot of time probably to do any reading. And I know a lot of mothers do. They're so organized, they have books and this and that. So I had a few books given to me by friends, and one was about feeding every 3 hours and really establishing a routine, and I did read a little bit about that. And I was also advised when I was leaving the hospital by one of the midwives that, yep, feed every 3 hours, that's just what your baby needs. And that's actually wrong. Now, it might be right if you have loads of milk and the milk is just spurting out, and your baby's really getting well fed from the get-go, from day one, from the first minute they're born. But if you have a difficult labour, if you're older, and apparently if you're a type A personality, so I met a lady who had twins in her 40s, and both of her babies had really low weight after a couple of days, and were in hospital for about a week actually, so they were both not getting enough food. So she was telling me she read about it, and if you have a university degree, you're older, you're type A personality, all these things go against you. I'm not really sure of the association why that is, but anyhow, things to keep in mind. So what I'm going to tell you is the things that I learned that really work. So what works to increase your milk supply, and what didn't work for me. And so the first thing was that I had heard all about the latch. So in breastfeeding, if your baby has a really good latch, that's amazing, because then they're going to take off milk efficiently from the breast. And the more the baby takes off, the more the demand is, the supply increases, and so you're going to increase your milk supply. However, if your baby is sleepy, if you have had a lot of medication or drugs during your delivery, then your baby may well be very sleepy, and they come out, and getting lots of milk from your breast is not the first thing on their mind. So they fall asleep at the breast very quickly. So after a minute or two, they're falling asleep. And you can be fooled into thinking they're just sleepy, and they're well fed, they've fed, and they're off to sleep again. And that's what happened to me. And so after a couple of days, we had to take our daughter into hospital because her birth weight had gone down by about 15%. So the baby is allowed up to about 10%, and that's natural, that's normal. However, if it's any more, then your midwife will probably send you to hospital to make sure there's nothing else going on. So our daughter was also jaundiced, so the skin was quite yellow. So we were sent to hospital. Met a lovely doctor who said to me, you have to give your daughter the bottle, which I thought that's okay. So supplement with the bottle as well as the breast, and then you have to pump. And she said you have to pump after every feed. So I tried this for a week or two, and every time I pumped, there was actually no milk coming out. And what was actually happening was that our daughter, Ella, was loving the bottle. So she'd take out just a little bit of milk that was there from the breast. Then she would really depend on the bottle feed to get her nutrients. And because there was only a little bit of milk coming off each time, the supply never increased. And you could argue, well, surely pumping would have increased the supply, but it actually didn't in my case. And I came across an amazing physician, amazing doctor in Canada called Jack Newman, and some of you may have already read his articles online, and he is so against the bottle. So he's against the bottle because of the artificial teat on the bottle, the artificial nipple that is so easy to extract milk from, and the baby then doesn't actually really want the breast, because here is this food supply that's so easy to get, and you know, your baby is smart. And so he explains that you want to keep the baby on the breast for every feed, and that includes even if it's a supplemented formula feed. And so what I discovered was that you can actually just put the formula milk in a little dispenser around your neck. So you hang it from your neck, and then there's a small tube that you tape onto the breast. And yes, it's foodery. It's foodery for the first week or so, and then after that it just becomes normal. And so I didn't try this for about a month. I think it was at least 3 weeks. So I tried that. I couldn't really do it. I was on my own. My husband was working abroad at the time, and so I was on my own trying to do this. So it was a bit challenging, and I probably it was too late, but I probably gave up after a week or so. And I did go back to it now and again. And then I met somebody that said, oh no, you just have to lie down with your baby, don't give them the bottle, and they will really create that supply for you. And so I tried that for a day, and my daughter cried and cried and cried all day. It was awful, like all day, and I just gave in. And then I'll fast forward to, we were living in Costa Rica then after that, and I met this absolutely lovely, amazing midwife from Canada, and she said to me, it was too late. After a month, it was just too late for you to try and really up the milk supply. And she explained to me exactly what they do in their clinic and when they go out to see women. And this is it. They put you on domperidone at the start if your baby loses that amount of weight. So you're on domperidone, which is an anti-sickness medication that actually increases the milk supply. And they discovered this, I think it was from sailors that were using this anti-sickness tablet. They were out at sea, and these men started to lactate. And so it actually stimulates milk production known as lactation. So she said you needed the domperidone at the very beginning. You needed to use the supplemental device at the very beginning. And she said you didn't really need to pump that much. Just keeping the baby on the breast with the supplementation device would have been enough to really stimulate more milk supply, even though there is a milk supply coming through this device. So that actually made me feel an awful lot better, because I met her probably at about 8 months. I'd continued to breastfeed. I said breastfeed because really Ella was just breastfeeding lying down after about a month. And so I would feed her at night, through the night. And I think it was more of just comfort. So she definitely got some milk off, but not an awful lot. And I would pump usually once or twice a day, and I'd get maybe 2 to 3 ounces just from this side. And I couldn't feed on the other side. And yeah, so I met this lady, total stress of not being able to breastfeed, and maybe a little bit of it was guilt, but also, you know, maybe it was a bit of like this ego that I'm this woman who is a mother now that couldn't breastfeed, you know, and I had failed. And I remember saying to my husband, you know, like, no matter what it is in my life that I've wanted to do, I'm getting a bit emotional talking about it, but, you know, I've always worked hard, and, you know, I've been able to do it no matter what it was. You know, I've worked hard and I've been able to achieve that or overcome something, but I couldn't do it this time. And, you know, that happens in life. You know, if you get a disease, there's certain things we can't overcome. And that was a real sort of realization into a part of me that probably was too demanding of myself. And yeah, and I think, you know, a lot of us are like that, particularly as moms. You know, we want to be how this perfect mother is supposed to be, and there is no perfect mother, as you learn as you get older, and you still fall back into that trap of how one should be. So fast forward then, so with Ella, I managed 8 months of kind of breastfeeding, 1 to 2 feeds a day, not feeling really good about it, feeling like a bit of a failure. Then I had our second child when I was, I think, 42, 43. And that was completely different. The delivery was probably worse in terms of like interventions and so forth. And so I had a cesarean in the end, but straight on, got the baby on, got our daughter on the latch, and the latch wasn't bad from the start, but she was straight onto the breast after the cesarean. And I was lucky enough, I had a friend of mine who was the anaesthetist behind me, and she was able to really check that the latch was okay. And I felt like I had a much more supportive team around me, which is interesting. The first time I felt slightly abandoned. That, you know, that would have been my overall memory, abandoned in the theatre with this really low blood level of sodium, and just waiting and waiting. And even though the care was really good on the ward, those initial experiences were just not very positive. Second time around was amazing. And, you know, the midwives are all amazing, but sometimes, you know, you really click with somebody and you feel like that person has your best interests at heart. And second time around, straight on the breast, but again, a low milk supply, unfortunately. And our daughter lost weight again significantly, but this time I said, okay, it's kind of just borderline. It was like 12%, I think. And I just was straight on the domperidone, and I think I didn't even wait. I think I'd started the domperidone, I brought it to hospital with me, and so I was on that. I had the supplementation device around my neck the minute we got home, and I wore that for a month. And yeah, I sat on the sofa pretty much for the whole day. I put on weight, unfortunately. So yeah, there's a lot of give and take in these kind of endeavors to breastfeed. And so I'm giving you a really quite intense experience that I had, but it took a month. It took a month for me to establish this supply this time, just with this device around my neck and some domperidone. And after the month, Florence, our daughter, was really refusing this supplementation, so I stopped it. And her feed was really quick, so it lasted about 2 minutes. I used to time it, just 2 minutes, and she was done. So the letdown of milk was so quick. That milk that comes out, she didn't have to work to get it. It was so quick, just flew out, and she was done in 2 minutes. And you know, obviously you have to give your baby some vitamin D if you're breastfeeding. You have got to drink lots of water, take vitamin D yourself. But the water, the oats, the milk thistle, the fenugreek, the porridge, all the things that people tell you to eat and drink to increase your milk supply, none of those worked for me the first time. I did them all. The only thing I didn't do soon enough was the domperidone and the supplementation. So yeah, that's it. Second time around, totally different experience. Had to work really hard, low milk supply. But by a month I was off the supplementation aid, and I kept going with the domperidone for another month or two, and then I just slowly came off that and everything was fine. And Florence, I went back to work at 5 months. So I had a year off with Ella. It was very different. But I went back to work at 5 months, opened our clinic, our medical clinic. I cycled up the road every day to feed her at lunchtime, and then picked her up around 4 o'clock in the afternoon to feed her again, and then obviously at night. And how I was able to do that, because I did express, but I didn't make a lot of milk either when I expressed in between feeds, and so I didn't have like a big stash of milk that the creche could give her. And also Florence didn't take the bottle, so nobody could actually give her milk other than myself from the breast. And so when she went to creche at 5 months, I had already introduced solids, so I got that from Jack Newman. So at about 3 months, I tentatively tried some pureed fruit, and I think that was it, just pureed fruit. And yeah, I just made sure I gave her lots of that with the breast milk, and so she was able to have that in the creche during the day as well if she was hungry, which was great. So yeah, I went back to work, and it was fine. I got really fit cycling, and yeah, it was great. And yeah, Florence was feeding up until about 2 months ago. She's now 4, almost 5, and you know, it's been a great comfort for her, and it hasn't been too difficult really, even as a working parent or working mother. And I think that's everything. Yes, I read this book that I'd like to share with you. So Making More Milk, I think it'll come up back to front on the video, and it's written by two women, Diana West and Lisa Marasco, and this was excellent. So it's really about making peace with your low breast milk, and it's fantastic. So I really commend these two women. And this really changed things for me as well. Even though I knew everything, this was kind of like the explanation that, look, this happens, and so you can prevent it happening, obviously. And so the second time round, I also had a breast consultant come out. I did the first time as well, and I think she put me on the domperidone, but you know, it was too late at that stage. It was past that 1 month mark. I hope this video was useful. You will see videos on YouTube, as I did, that said drink lots of milk, drink lots of water, eat oats, you know, drink beer, take these herbal remedies, you know, a lot of which I did the first time round as well, but none of them worked for me. Obviously, staying hydrated, taking vitamin D yourself, giving your baby, your breastfed baby, vitamin D is really important. But in terms of making milk, the domperidone and the supplementation aid work, and the bottle definitely will detract from your goal of solely breastfeeding.